What do you think about this electrocardiogram? What is your interpretation? Hi everyone. In the present episode, we have an EKG quiz. This electrocardiogram belongs to a 90-year-old female, known case of hypertension and rheumatoid arthritis, presented to emergency department with generalized weakness. What do you think about this EKG? What is your plan? Pause the video, and try it yourself. Then we go through the strip together. As before, to make a proper interpretation, we are supposed to utilize the 10-step approach. First, start with standard values. Here, the calibration marker is 2 large boxes tall, and 1 large box wide. So, this is a standard strip. Second is cardiac rhythm. The RR intervals are variable and irregularly irregular. No discernible P wave is present. So, the underlying rhythm is atrial fibrillation. Of course, you might see some deflections in favor of P waves. But remember that, P waves with variable morphologies and PP intervals may be observed in coarse AF as well. Third item is heart rate. There are 6 beats within 20 large boxes. Every large box is 0.2 seconds, which means that there are 6 beats in 4 seconds. So, the heart rate is 90 beats per minute. Fourth step is axis analysis. The QRS complexes are positive in D1 and D2. So, the electrical axis is normal. Next steps are P wave and PR interval. Since there is no discernible P wave in this strip, P wave and PR interval are not measurable in this case. Seventh step is QRS complexes. As usual, examine 4 items to establish the complex changes. 1. QRS duration. QRS duration is a bit more than 3 small squares. So, the complexes are broad. Bundle branch blocks, accessory pathways, electrolyte disturbances, particular drug toxicities, pacemaker and ventricular rhythms, are well-known causes of QRS widening. QS pattern in V1, with coexistent slurred and clumsy R wave in V6, and R peak time greater than 60 milliseconds in V6, confirm LBBB as the cause of QRS widening in this strip. 2. QRS amplitude. QRS amplitude is more than 5 mm in limb leads, and more than 10 mm in precordial leads. So, it is not low voltage. None of criteria of ventricular hypertrophy is present as well. Therefore, QRS complexes have normal voltage. 3. R wave progression and transition zone. Thanks to LBBB, the transition zone is in V6. So, R wave progression in this strip is poor. 4. Look for pathologic Q waves. Luckily, there is no pathologic Q wave in this strip. In summary, QRS abnormalities are as a result of left bundle branch block. Next part is examining STT changes. There are ST elevations in AVL and V1 to V5. ST depressions are present in V6 and inferior leads as well. If we take a good look, we find out that ST segment abnormalities are in opposite direction to QRS complexes. This is so-called negative concordance STT wave changes. In AVL and V1 to V5, QRS complexes are negative, while ST segments are clearly elevated and T waves are upright. Conversely, in V6 and inferior leads, QRS complexes are positive with associated ST depressions. Negative concordance is a normal finding in wide QRS complexes including LBBB. The 9th part is QT interval. Thanks to heart rate variability in atrial fibrillation, QT interval is dynamic and changes with heart rate. So, we must measure several intervals and use the mean value. In this strip, 3 corrected QT intervals are shown in lead D2. Therefore, the average value is nearly 450 millisecond, which is prolonged slightly. The last part is overall interpretation. Before going through this part, If you liked this video till now, please subscribe me and ring the bell for further videos. To interpret our EKG properly, we must make a list of abnormal findings. In this strip, abnormal findings are: irregular rhythm due to atrial fibrillation, left bundle branch block, and slightly prolonged QT interval. Note that AF in association with LBBB is in favor of heart failure. Long QT can be due to heart failure too. So, according to electrocardiographic findings, our case is probably suffering from heart failure. On the other hand, new AF can be the cause of weakness. Thanks for watching this video. If you are eager to gain knowledge about electrocardiogram and test your skills in EKG interpretation, subscribe me and ring the bell for further challenging cases. Have fun!